Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you and broadcasting live from the Dolph Simons Family Studio here with our ever-faithful Doc Hawk. We've also got a couple of really great folks to join us this morning. Dr. Kevin Ault, OBGYN and member of the CDC Advisory Committee on Immunization Practices, who has been with us before, is back with us today. He's going to tell us all the top secrets that are coming out about COVID-19 vaccines. He does have an important update for us. We're looking forward to that. And Dr. Roy Jensen, the director of our NCI-designated cancer program, sounds the alarm of the consequences of fewer cancer screenings during the pandemic. We're going to look forward to talking to Roy, too. Roy and I have been through a lot together, good friends, so thanks for joining us, Roy. First, Hawk.
Yeah.
Medical Director, Prevention and Control.
Yeah.
Infection Prevention Control, whatever your title is. How are things today?
I feel great.
Do you?
In about 2 weeks, I'll be optimally protected after my second dose of vaccine.
Yeah, and you were talking about wanting to get to that. What was that concert you were talking about at Arrowhead?
Well, we were talking about masking and all that.
Yeah.
When we could get there, but
get herd immunity.
The Chiefs, but also, Kenny Chesney's going to be at Kenny Chesney.
Chiefs.
Right, I understand.
Okay.
They're both good. We need them all. We need to have fun again.
We do need to have a lot of fun again.
And we need to be in social groups
and be able to get together and hang out.
Yes.
So how are the numbers today? What's it telling you?
I'm pretty happy about that, too. We're kind of pushing down to that century mark. And what I mean is we are down to 105 total patients here in the hospital. So 54 of those are active, with 11 in the ICU and 9 of those on the vent. So still a high proportion on the ventilator, with 51 in that recovery period and 9 still on the ventilator. But again, the total number is 105. Hayes is doing better as well, with 13 COVID patients in the hospital, with 11 of those active and 2 in that recovery phase.
So they're down. We're down.
Yeah.
I like the trends. I think it's a race right now with time, the variant, and vaccination.
Yeah, absolutely.
Let's see how that goes. Hopefully it'll go well. All right. So also, how are you feeling since your booster shot on Tuesday?
Yeah, that's the other thing. I feel really good today.
Awesome. My wife is an OBGYN. She had the Moderna shot initially, got her booster yesterday. Felt kind of chilled last night, but today she said she feels great. So I think we're making progress. That's good news. Let's first turn to see if there are reporter questions before we turn to our guests. Any reporter questions out there?
Good morning. Cody Holyoke, KMBC
Hey, Cody.
News.
Cody.
Hey. Welcome back.
Thank you. Every other day I'm here.
I love it.
With Dr. Ault, and maybe I'm beating him to the punch, but asking about Johnson & Johnson vaccine and potential for more vaccines to get thrown into this pool. I know President Biden had talked about more vaccines becoming available. Just what's coming down the pike?
Let's do that. You know what? Yeah. Let's just turn to Dr. Ault first, because I think we're going to pull him into all these questions anyway. So how did the meeting go yesterday? What do you know about J&J? What do you know about vaccines in general? And when are we going to have a whole bunch more when we get ready to vaccinate 330 million worth? Go ahead. It's not a tall order at all.
So there are 3 vaccines kind of in the offing. The AstraZeneca vaccine, Novavax has a vaccine, and Johnson & Johnson has a vaccine. The difference about the Johnson & Johnson vaccine is that it's a single dose, and it has different handling characteristics. So being able to, take something in a refrigerator and be able to give a single dose really opens up, a lot of possibilities as far as vaccinating a wider group. And the AstraZeneca vaccine has some of those characteristics too, but it's a 2-dose vaccine. So yeah, the meeting we had yesterday was an emergency meeting, although I think it's the 11th or 12th emergency meeting we've had in the past 6 months. But the data's all out there. The slides are all out there. There are no secrets. Sorry to burst your bubble a little bit, because it's all very transparent. But the news is good. There are going to be, a lot of this is going to be happening next month.
So did you guys get to see some preliminary data on the J&J vaccine?
It was mentioned briefly, and apparently they're going to have a press conference on Monday, but coming up pretty soon. And usually if they're having a press conference, that means it's going to be in a major medical journal. Of course, the other 2 vaccines that are available under emergency use authorization were in the New England Journal of Medicine within a day or 2 of the press conference. So we all ought to be able to look at the data. I mean, anybody can go to those journal websites and look at it themselves. There's all the documentation on the FDA. I actually tried to look for something on the FDA site, and there's so much documentation on there yesterday, I couldn't find what I was looking for. So it's all very transparent.
Hopefully it will be good news, but it sounds like we'll know more Monday. And then what you did talk about, did they get? I'm with you, first of all. Companies don't come out and say, hey, we're going to have a really big announcement. Hey, we're going to publish our data, unless it's really good. When it's bad, as we saw recently with Merck, I believe, had 2 vaccines that didn't look good, it was just a very quiet article, and you know, like, oh, the Merck vaccines didn't work, but not a lot of stuff went out around that. So I'm guessing the J&J stuff's going to look good.
I mean, they're an enormous company, and you know, they have a number of vaccines that they've been working on, including an Ebola vaccine. So, yeah, I mean, I think the president is correct. We're going to have more available in the next 2 weeks.
Now, do you think that the J&J vaccine is one that might be able to even be given in physician offices where patients seem to have a high preference for getting things and want to be able to talk to their primary care provider, unlike Moderna and Pfizer, which because of the cold storage logistics, that doesn't work as well? What are your thoughts about that?
That was certainly mentioned, and there's also a public comment section of the meeting, and several physicians were on the public comments and mentioned that. But yes, I mean, these are vaccines. The next round of vaccines are going to be refrigerated, not frozen. If I remember correctly, and you should fact check me on this, the AstraZeneca is good for 6 months at refrigerator temperatures. So certainly if you give flu vaccine or you know, the measles, mumps, rubella vaccine, you should be able to give these vaccines in physicians' offices. And the other thing is we might be getting to the point where, you know, we're hopeful we're getting to the point that there'll be enough supply to meet demand.
Yeah, I mean, that's been the biggest challenge. You know, we said in the program yesterday, there are the vaccine nevers, the vaccine maybes, the vaccine patient, and the vaccine right now. And I think one of the things that's happened is it's so confusing to people about where to go to get vaccination. It's become, because of probably a lack of transparency and good communication, people are so frustrated because they want the vaccine right now. For example, you know, in our own health system, we were given vaccine for all of our employees, and we had to list the total number of employees we had. That's how much vaccination we have. And then what we did is we had vaccine hesitant, people who didn't want to get the vaccine yet. And so we took that vaccine and we worked with Johnson County and Wyandotte County to say, guys, who else can we help you vaccinate? We did some of that. I forgot the exact number. It was like 2 or 3, around 2,000 doses or so between Wyandotte and Johnson we sent there. And we still had some doses left, and we started on our patients who are over 65. And what we did for the folks who are over 65 is we took all of them together, and there were about 80,000 in our primary service area and 130,000 overall who are over 65 and who we have seen in the last 3 years, so a very broad net. So if you think about it, we had 2,000 or 3,000 doses and 80 to 130,000 people to give those to. Well, how can you possibly make a good determination around that? So what we did is we took all the people who are over 65 and we said, listen, if you're over 65, you have a chronic condition, just almost by definition. And so we just used a random number generator, and we randomly assigned people from 1 to 80,000 or 1 to 130,000. And then we just went down the first 2,000 or 3,000 names and started offering vaccine to people. And as we get more vaccine, we're going to keep going right down that list. But what that did is it made 2,000 or 3,000 people super happy, and, you know, like 100,000 people really mad. And it's not that it's a bad intent. The problem isn't that we don't want to give it. The problem is we do not have it to give. And ultimately, when we get enough vaccine, I promise you, we are going to come looking for your arm. And we want you to feel that call to arms and come be a part of that. And that'll be our strategy going forward. And we continually work with KDHE, with and all levels of state government, Wyandotte, Johnson, and out west with Ellis County, and throughout Kansas to try and figure out how can we help people get vaccinated. Because really, that's our goal. And so to all of you who are vaccinated now, we are right there with you. We think the real issue, it is not a problem that we don't want to give it. The problem is one of supply, and as soon as the supply ramps up, we will be chasing off after your arm, and we're going to be tagging you if we can. So remember, I understand vaccine now. Please be vaccine patient. And while you're out there, talk to all those vaccine hesitant and let them know our data has demonstrated remarkably, Hawk, the fall in the from in terms of our employees, or all of our healthcare workers, et cetera, The fall in people being absent from work because of COVID-19 is dramatic. Yeah. Vaccines work.
Yeah, absolutely. You know, it happens, it starts to happen really after that first 2 weeks after that first dose, but really after that 2 weeks of that second dose. It's amazing, and that's exactly what the study showed as well, and it keeps people healthy, and it keeps them well.
So just be patient. We've had to work hard at it. And remember that up until the time you get vaccinated and for the 6 weeks after you have maximal immunity, remember the rules of infection control, which travel with you wherever you go, will keep you safe. Okay, end of lecture. Next question for the reporters. Cody, go ahead.
Shane Bergen with KCTV5 has a question. He says, this is in reference to Dr. Fauci talking about double masking. Mm-hmm. He wants to know, how do you do it? What's the proper way? 2 cloth, 1 surgical and a cloth?
I don't know. You know, what I can say is that I think it's just a matter of layering the mask. So, you know, there are people who we have seen who wear an N95 or a KN95 mask that you buy at the hardware store and then have a cloth mask over it. Some people have done that, but have a surgical mask over it, one of those surgical masks either from the hospital or that you can buy at the pharmacy or the grocery store that we've seen. Some people are double layering or double masking with those 2 to 3 layer cloth masks as well. There's really no good guidance on that. Again, what he said, to paraphrase, is it makes common sense that would offer a little bit more protection. We're certainly not going to discourage it. I'm still wearing 1 mask, but I think any way that you want to just double up on your mask, we've seen different ways. We've seen different ways here in the hospital where people are wearing an N95 and a surgical mask. On top of it, again, that's a special situation. Those are people who are in aerosol generating procedures for most of the day and have that surgical mask on as a barrier protection so that they can remove that and continue to wear their N95 mask as well. So it's a different situation. But I think any way that you can find, if you do want to wear a double mask and it's comfortable for you, I think that's adequate until further guidance comes out.
And I would just offer this, that if you are going to wear an N95 mask, A, they're most effective if they've been fitted, which most people don't do.
Correct.
But B, if you put a mask over the N95 mask, you actually may defeat the N95 mask by putting pressure on the sides of it and opening it up. So just be a little careful if you're going to wear an N95 and put another mask over it. Just be thoughtful about how to do it, because you may actually open up somewhat around the sides of the N95 mask. So be careful with that. Other questions?
I'm out of media questions.
Awesome. Let's turn to Roy Jensen. Roy, one of the pandemics we have to be challenged by, and we want to be careful, is a pandemic about cancer. Because if people are delaying cancer diagnosis because they're afraid of COVID-19, we could really see a rise in cancer deaths and other challenges from it. So talk to us a little bit about that.
No question about that, Steve. And, you know, normally, if we saw a decrease in cancer diagnoses, that would be something to be celebrating. But of course, under these circumstances, there's absolutely no evidence whatsoever that the number of true cancer cases has decreased at all. And so some of the concerning studies that have come out about this is that one study showed that as many as 1/3 of adults in America have put off recommended cancer screenings like mammography, colonoscopy, pap smears, and the like. Over the last few months, we've seen a 50% decrease in the number of cancer diagnoses. And of course, we know that there is no real decrease in incidence. People are just not coming in. The percent of decrease in mammography, colonoscopy, and some of these other studies has been anywhere from 50 to 85%, which obviously is very concerning. And you know, one of the things that we don't talk about enough is that due to the economic disruptions in COVID, we've seen nearly 12 million people lose their health insurance because that is intimately tied to their employment. So these are issues that are enormously significant. And if a study from the National Cancer Institute, in fact, showed that if we have a 6-month disruption in screenings, over the next 10 years, that could account for an additional 10,000 cancer deaths due to delayed diagnoses and diagnoses at greater stage.
We're part of a letter that was put together, I think, by the National Comprehensive Cancer Center, or from National Cancer Centers and the American Cancer Society. We're one of 70 of those really special organizations. Talk to us a little bit about that letter. What does that mean? I know you signed on.
So the organization is actually the National Comprehensive Cancer Network, plus about 70 additional cancer centers and the American Cancer Society. And essentially, it's really a call to action to highlight this issue for people and to bring to the top of their mind the fact that they really need to engage in this screening activity. I think there was some reasonable caution initially as we figured out how to conduct these screenings in a safe manner, how to make sure that our clinics were not a cause of spreading COVID, but we have really done that. There's practically no evidence whatsoever of any cases that have been transmitted at our healthcare system between provider and patient or patient to provider, and that's because we really have instituted a broad range of infection control procedures that have been quite effective in limiting the spread of this disease. And so I think the message that people can take away from this is that we know how to do this, we know how to do it safely, and that you're putting yourself at significant risk of being diagnosed with a cancer at a higher stage and more likelihood to cause death if you put these procedures off.
One of the things I know that you don't want to see is a pandemic begat a pandemic. So there must be a lot of things you've done down at the cancer program that you've seen done down in our cancer center to keep people safe when they do come in. Let's talk a little bit about that.
Oh, absolutely. So, we require everyone that is in our clinic to be wearing masks, whether that's a provider, whether the patient, or visitors. We've also really tried to limit the number of people in the clinic at any one time. So many patients, unless there's a special circumstance that justifies having additional people with them in the clinic, we're really trying to limit that. And of course, that's for patients under the age of 18 if there are mental competency issues or if there are mobility issues. Other than that, we're limiting visitors in our clinics. Of course, we've really ramped up our efforts around cleaning, and so in between exams, we have crews come in and clean the areas. We don't have patients sitting in the waiting area anymore as much as possible. We try to have people show up on time for their appointment, and we quickly get them back into an exam room. And this is just an example of some of the things that we do to try to limit exposure. We try to limit the number of people that are congregating in our clinics. And like I said, it's been extraordinarily effective in terms of limiting the spread of this virus at our healthcare facilities.
Yeah, and I just so hats off. You guys have heard me say it before, I have prostate cancer, and I'm a patient in the cancer center, and I always felt safe. I'm a pretty harsh judge. I'm the guy that goes around and reminds people to pull their mask over their nose, and I felt really safe. And they give me the little beeper thing, and you go down there, and you can kind of wander around. Your pager goes off. They bring you right in, and so you're really safe down there, Roy. And I just want to say to all of the folks out there listening, I know that everywhere around us, all the hospitals are working so darn hard to keep people safe. We've had one case on our inpatient side. Outpatient side's the same story, of somebody getting COVID-19 and a family member brought it into them. So when they were visiting. So we don't see viral transmission inside our health system. This is a really safe place. Don't be so afraid of COVID that cancer gets you. Don't let that happen. Don't survive COVID just to get cancer coming after you, because you don't have to do that. This is a safe place. Jill, what questions are out there in our community?
All right, we got a lot of them today. We're going to start with 74-year-old Bretta. And she says she understands the randomization that you talked about in terms of selecting patients that are ours. But she read in the JOCO Daily newsletter that KU Health System is investigating ways to administer the COVID vaccine to non-system people. And she wanted to know if we are ready to talk about that. Do we know what that is?
Yeah, so here's the deal with that. So again, when we had vaccine hesitant staff of our own, and we were around 70% of our folks have been vaccinated, 71 I think, we took that extra vaccine, we offered it to the counties, we worked with Johnson County, we worked with Wyandotte County, we vaccinated some of the essential workers and healthcare workers in both of those counties, and then the vaccine that we had left, we offered it to those who are over 65. So that was we have not received any shipments of vaccine actually designated for patients. But we worked with KDHE, as did other counties all across the state, because they had similar stories. And we said, okay, if we have excess vaccine, who do we give it to? We started with those over 65 per CDC and KDHE guidelines for phase 2 once we were allowed to move into phase 2. Now, going forward, we are working with the counties to try and say, this is what we're going to do as far as offering vaccines. So if you go to this website on our health system under COVID-19 updates, you'll see the story. It's right there. But we are working with the counties and the state government to determine, as more vaccine comes in, how are we going to help? You know, Johnson County did a big vaccine clinic recently. I think what we've said to the Johnson County, and the same thing we've said to everybody, let us help you. I think Advent's ready to do that. I know Olathe's ready to do that. I think we're all ready to try and help as much as we can by offering vaccination. Currently, as we understand it, vaccines are going to go to the health clinics first, or health departments first, and then it can be distributed from the health departments. They can choose to vaccinate folks, and others, they can give some to the health systems. Again, KU is ready to help along with Advent and Olathe and others. And I know in Wyandotte County, they've set up 3 mass immunization clinics. I think they've done a really good job around that. I want to say I've heard that they could do like 25,000 patients a week, which is a big number. Again, we're ready to help Wyandotte County. We're ready to help Johnson County. We just got to be given the vaccine. And we think our lane, our best lane, is our patient base. And those over 65 is where we would start, because that's where Kansas is, and that's phase 2. We use MyChart as well as phones, as well as email and other venues, our modalities to try and get to patients. We stand ready to help. We can do 10,000 plus a week. Just by our own health system. I know Advent and Olathe, again, they're ready to go too. So we're just ready to help. We just need vaccine. Our shortage is vaccine. It is not the desire to help.
Shirley spent 45 minutes with her granddaughter on Friday. She was masked. Tuesday, her granddaughter tested positive for COVID. She wants to know, I'm supposed to get my shot today. Should I do it?
So she spent her when? Thursday?
Friday, 45 minutes.
Okay.
And then on Tuesday.
Do not throw away your shot.
Yeah, I would still get it. So, and Dr. Ault can certainly comment on this. Right now, initially, from those first CDC guidance was that there was no minimum time between infection and vaccination. We certainly don't want you to go to someplace and stand in line or be in an area with a lot of other people if you have active infection, because you need to be home isolating for 10 days anyways. You know, it's unclear. Certainly we know from contact tracing, really that time period is 48 hours before any symptoms start. So I think we need to understand that too. When did the daughter first have symptoms? That would help identify things as well. But I think overall, unless Dr. Ault has another opinion, probably go ahead and get the shot, especially if you are asymptomatic at this point.
Dr. Ault.
I agree. I think the guidelines are not to go get vaccinated if you're sick, because you don't want to expose other people to COVID, the people who are giving you the vaccine, basically. But if you're not sick, get vaccinated.
And Dr. Ault, your thoughts about women who are pregnant, should they get the vaccine? I mean, there's some emerging information that talks about that. Where are you with that right now?
So there were a couple of publications late in 2020 that made it clear, huge publications, and actually one just last week, that made it clear that pregnant women had increased risk of intubation, increased risk of ICU stay, increased risk of death from COVID compared to other healthy young women. So it's somewhat similar to other respiratory diseases we see in pregnancy. So there's risk there. Unfortunately, there's not a lot of data about the vaccine. And so you can't really reduce it to a headline. It's a long conversation with a pregnant patient. And you have to talk about, do they have an occupational exposure? Of course, the first groups of people that we vaccinated were healthcare workers, and they have lots of occupational exposure. So we did vaccinate a lot of pregnant healthcare workers. There were 15,000 people that are pregnant that are part of the V-Safe program we talked about yesterday. You also have to think about community spread. Well, in almost all the United States, community spread is horrible and out of control. So there's that. You also have to think about your ability to isolate. You know, are you able to work from home? Do you have access to personal protective equipment? As far as a pregnant woman is concerned, you know, she has to think about, you know, we don't have data. We don't have any, a priori, we don't have any beforehand reason to think that this vaccine is dangerous, because the first two vaccines are RNA vaccines that break down very quickly. But we would have liked to have data to inform decisions, and we just don't have that now. So there's not really a one-size-fits-all approach to the 3 or 4 million pregnant women in the United States right now. And the American College of Obstetricians and Gynecologists just issued an updated practice advisory yesterday, late in the afternoon. There weren't a lot of substantial changes, but there's certainly guidance out there to help providers who care for pregnant women and to help pregnant women as well.
Janet wants to know, who do you contact about getting a monoclonal antibody infusion? I think we have a couple of places.
We do, Hawkeye. I think that's an important question, because monoclonal antibody infusions are an important adjunctive therapy. We know they lower hospitalization rate. New England Journal 2 weeks ago had both the Regeneron product and the Eli Lilly product they were speaking about. A good editorial along with those to help explain some of the data. But clearly a big drop in hospitalization for folks who get that, who are in high-risk groups.
Yeah, and right now we are actively screening all the tests that come through, all the positive results that come through our health system. So if you're tested, that screening includes age specifically, and then other comorbidities, and then those are actively identified, and people are called and screened for those. There are other facilities around the metro that are offering that as well. We are looking to expand that out to other populations rather than just our patients. But right now there are just, we have the screening time, the infusion times, things of that nature that have kind of just slowed down. It's not just as easy as going and picking up a prescription at the pharmacy. It is about a 3-hour process where you get in, you do the paperwork, you get everything ready. The infusion takes an hour. The the monitoring time after that takes an hour. So overall, it's about a 3-hour process. So scheduling it and getting everything done, we aren't giving it, again, in high amounts, but we have given about 170 infusions and have seen very good results with that. So we are actively screening our patients right now for that.
So if you go to our website, you can find that, and also I think if you call us, we can get you in touch with that group of folks. So.
Ashley asked, is there any chance of baby being born with immunity if mom gets a vaccine while pregnant?
What do you think, Dr. Ault?
Yes, and other vaccines that we give during pregnancy, that's one of the advantages. The influenza vaccine and the pertussis booster gives immunity to newborns. However, newborns probably don't have much risk from COVID, so it's a little different than other respiratory diseases we see where both the mom and the baby are affected. So, but yes, I guess that would be a bonus, that the baby would have some protection.
Joyce says, I've read that many died from the vaccine that are elderly with underlying conditions. Is this true?
Oh, it is not true. People are not dying from the vaccine, Hawk.
No, absolutely.
We've given over 13,000 doses of vaccine, including a lot of elderly people, kind of like me. And guess how many people we've had die from the vaccine? 0.
And even, even not even death, but even severe anaphylactic reaction or anything like that, maybe a step below death. They've even revised the numbers. The CDC has come out and revised the numbers, and it's only about 2.5 to 5 per 1 million doses given for those. So not even death. So yeah, I'm not sure, and Dr. Ault can maybe comment, but no instances of death from the vaccine.
And so, Dr. Ault, you've said it before, all the data's out there. There's no conspiracy theory. This is not QAnon. This is not, there's no fake news here, people. This is real.
Printed this off from the presentation yesterday, so I anticipated this. So, again, this is a nuanced answer that doesn't really fit into a headline, but yes, there are deaths being reported. 20 million doses of vaccine given out so far, 200 deaths, 196 deaths reported as part of the vaccine adverse reporting event. A majority of those are people that are in long-term nursing care facilities. Yesterday, and I hadn't heard this number before, about 22% of people in long-term care facilities die every year. So there's, it's a frail, elderly population that's not in good health. And when we looked at the data, it was less than you would expect from the natural end-of-life type of processes that are happening in those centers. So there was no danger signal based on these reports. So, and overall, there was cardiac mortality, which is the leading cause of death, of course, in the United States. And it was true that way for younger people too, but it was apparent in both groups that they were people that had severe medical illnesses. And of course, that's why they're in long-term care facilities. So no is the shorter answer, but the longer answer is the nuance that we talked about yesterday.
Those things where you say, okay, he got the vaccine and then he died, so therefore he died of the vaccine. Yeah. Well, no. He was in a car accident. Or things like that, or as you pointed out, the risk of death in a nursing home is about 22% per year. That's why you're in a nursing home, and if you get the vaccine, then there is no increased risk of death from that. So I think vaccines do not cause death. Vaccines do not cause autism. Vaccines do not cause, and the COVID vaccine is not going to cause you to have a bad side effect. On the other hand, COVID-19 is a deadly disease, and 10% of people who are admitted to the hospital with COVID-19 will die from it. That's a national statistics. That's real, and it is COVID-19 that caused it and not anything else. So, people will say, well, it didn't really cause it. Well, no. Anybody who comes to the hospital may have another condition, but the reason they're in the hospital is because they got COVID-19. Had they not had COVID-19, they would not be in the hospital. And so we just have to remember, It is a deadly disease. Vaccination is not a deadly disease.
Cindy has a cancer question. She wants to know if radiation or chemotherapy impacts the vaccine.
What do you think there, Dr. Jensen, anything?
There's no suggestion that they impact the vaccine. I think there's a lot of data, however, that COVID definitely is prone to many more severe have a greater impact in patients getting chemotherapy or radiation or surgery. So I think actually it's a great segue to a point that I wanted to make, is that I think cancer patients, particularly those that are undergoing active treatment, should be ones that are prioritized for the vaccine, because they are at much greater increased risk for severe adverse events.
Dr. Ault, any other thoughts around that?
No, I agree. There are lots of conditions that adversely affect your immune system that put you at higher risk for COVID. Unfortunately, some of those people got enrolled in the clinical trials aren't getting vaccinated now, so we have a little bit of data, but it might have adversely affected. Again, you said this, you should get vaccinated.
Judy writes, is the vaccine a threat to placentas now or in the future? Some wacko is stating this. She won't vaccinate women under the age of 50.
Oh, makes my head hurt. Okay, Kevin.
I think you've asked me this every time I've been on the show, so I'll just reiterate what I said before. There was a social media rumor maybe a month ago, I think it was a couple of days before the end of the year, that I saw for the first time, that there's synergy or similarity between the placental protein and some of the proteins on the spike protein of coronavirus. It was sloppy science. That probably isn't true. The people that claim that probably don't have the greatest scientific credentials. So women should be vaccinated. That's on your list of things to worry about. That shouldn't be very high. I think the other thing, if you ever look at any of my social media posts, that's been go-to misinformation about the influenza vaccine and the human papillomavirus vaccine and the tetanus vaccine 25 years ago in Africa, where we're trying to stop neonatal tetanus. It always tries to, infertility from vaccines is low-hanging fruit for people that are anti-vaccine, unfortunately.
Yeah.
Melissa wants to know if Dr. Ault could speak to the status of pediatric clinical trials.
All right, trials for pediatrics, good question.
Talked about that extensively, and some of those are going on at Children's. I'm sure the people I've been in touch with Dr. Hood and some of the other people you've had in the briefings, morning briefings. Basically what's going to happen is you're going to start at older teenagers and go down. And so we talked about that extensively, and there's certainly plans in the works. And I think the two vaccines under emergency use authorization have started to enroll children and adolescents basically in trials, and one of the two is fully enrolled. And then you keep going down. That's pretty similar to what we've done with influenza vaccines and lots of other vaccines that are primarily made for adults. And so, there's a very nice presentation about that, and we're going to be getting into children as far as data goes in clinical trials. So yes, that's going on right now.
All right, and Isaac and Anil get the last question.
Isaac and Anil. Anil always gets to have whatever question he wants.
All right. They both want to know your thoughts on what is people being vaccinated. Is it people being vaccinated or the threshold of the cycle for the PCR test going down? So is it fewer people being tested?
Oh, why is the number of positive cases going down?
And Anil wonders, is it because we vaccinated everybody in nursing homes?
Yeah, so I think all of the above is true, Hawk. I'll Dr. Ault and everybody weigh in, but I think what we're seeing is, first of all, behavior, right? People have done a better job of masking, and I think one of the things we were afraid of is that when they went inside for the winter, that the restaurants would be more crowded, the homes would be more crowded, and people wouldn't be masked. But in fact, what's happened is, and unfortunately for businesses, obviously, they're just not as heavily attended right now. People are wearing masks, they're doing a better job. And and hats off to KC, right? We have done a better job, and we've bent the curve. So the numbers are going down, and they're going down nationally, but they've really dropped in the Midwest. So that's really good. So I think behavior's affected it. I think the other thing that we're starting to see from hospitalization perspective, about 65% of nursing home patients have been vaccinated. I think that's starting to affect our number, but our average age of admission has not dropped yet. And I think that, what we need to go back and do is look at where patients came from. And so we'll try and research that data a little bit more.
Yeah, and in the general population, I would also say that really the amount of people that have been vaccinated is not
still really small,
significant. A lot of the people who have been vaccinated are healthcare workers, so they are using PPE, they are using proper technique. Although they do get infected, and we have seen that we have people who have been out.
At home is what they leave the community and they get.
And they've missed work and from infection and quarantine. But I think that number is much smaller. So I think it is the combination of those other things rather than vaccination itself.
And just to be really honest, I would guess, and this is purely a guess, that more people who have really risky behaviors have already had COVID.
I would think so.
So they may have some natural immunity. Thoughts, Dr. Ault?
No, I agree with what you're saying. I'm not sure I have much to add. Although I was looking over my notes from yesterday, if that's the last question, we haven't really talked about variants, and we talked about that a little bit yesterday.
Go ahead.
Well, it made me think of back when I was in medical school, because they showed some in vitro neutralization data, and the neutralization data looks pretty good. I mean, most of it's only a few weeks old, but it looks like sera from people who are vaccinated does neutralize the virus in a test tube. And so, that's usually the first pass we have. The ways to find virus that may be resistant to host responses from vaccination is to go out and look for it. You started the show by saying, infection control is still the same as that it's always been. And so you're going to have to do surveillance to look for people that get ill even though they've been vaccinated, or mutations that seem to pop up in people who've been vaccinated. So, and that work is ongoing, and that was part of the discussion yesterday. But it's not doom and gloom, I guess, based on the first pass of the data.
Which I think is good news. All right. Well, I want to, first of all, just tee up a little bit for tomorrow. Amanda Cackler, the Director of Quality and Safety, joins us to help answer questions, especially around infection control and the like. And we're going to ask you to participate in a call for recipes for your favorite Super Bowl eats. Go Chiefs. These eats had better be red and yellow. Let's just say royal red and gold. But the twist, though, on this is to make them healthy. We'll have more details tomorrow. Dr. Jensen, final thoughts that you want to leave us with today.
Well, I just want to reemphasize the fact that we have worked really hard to make sure that our clinics in our healthcare facilities are safe environments for our patients, and we have done that as you've talked about. And so I would encourage everyone to get your mammography, get your colonoscopy, get your Pap smears, get your skin checked for melanoma. And at this point, it's critically important to get back on the stick for those things because, there was a study published by the National Cancer Institute that suggested that because of COVID, there may be an additional 10,000 deaths from breast and colon cancer alone due to delay in diagnosis. So it's a serious issue.
Yeah, and, the old saying, those who hesitate are lost. Don't get lost to cancer here. Dr. Ault.
I mean, I think one of the bits of news from yesterday that really struck me, and I can show this, I guess, although it has some of my scribbles on it. So the bar there, if you can see, is 1 million doses per day. So for about the last 10 business days in the United States, we've given over 1 million doses of vaccine every day. And that's the way out of the horrible pandemic that we're in the middle of. And so, and Amanda Cohen, Dr. Cohen, who's our executive secretary for the ACIP, gave that presentation, and I was really, sad but encouraged that we're making progress.
Yeah, it is, and thank you for your service, and Roy, thank you for your service, and thank you both for being on the program. You're going to get back here pretty soon. Hawk?
Yeah, thanks to both of our guests, and certainly would like to echo Dr. Ault and the vaccinations. The vaccines are the way out. Hopefully, as we get, 1 or 2 or maybe 3 more vaccines with increased supply, we will be ready to give those here at the health system, and certainly work with anybody to try and get as many people vaccinated as possible.
Remember, folks, faith, hope, and infection control that brought you this far. Hope to make sure we can get through this crisis, the faith in each other, and in our sincere honesty to try and do our best. We need more vaccine. It's coming. And when the chance is offered to you, don't run away. It is a call to arms. The marathon can become a sprint when the vaccine is here for us, and we want to finish hard. So when it's your turn and when you get that call to arms, don't be shy. Don't be hesitant. Keep the faith and hope and know the vaccine will help keep you with both of those. We're back tomorrow to answer more questions. And remember, the rules of infection control travel with you wherever you go, and there's still no place like home. We'll see you soon.